Theories can be a hypothesis that are tested and supported and then become a theory. I personally think that Ida Jean Orlando's deliberative theory is a very good theory. The best way to evaluate if a theory is useful is to apply the theory into practice. Theories should be able to be used in nursing education as a tool for nursing staff. There are 5 criteria to evaluate nursing theories. These criteria include: is the theory logical? Can the theory be tested? Has the theory received empirical support? Is the theory broad in scope? And does the theory have real-world use? The theory is logical because the use of the theory explains the nurse's role in discovering and meeting the patient's immediate needs and helping to meet those needs. It is proven that patients have better outcomes and hospital stays when their needs are met. Patient satisfaction is often influenced by non-medical factors because most patients do not have a medical background. So when their immediate needs are met, they have a higher satisfaction rate. The deliberative theory can be tested because it has been tested multiple times. The majority of hospitals have surveys that you fill out after you've stayed with them in order to determine your hospital stay and if we met your satisfaction needs. Empirically supported theories are theories that have evidence to prove that they are in good practice. Ida Jean's theory is empirically supported because we are always associating good quality care with good patient outcomes. Therefore, hospitals get judged and are held to standards by associations like the Joint Commission. It is proven that there are requirements that need to be met for quality patient care and for safety as in the environment. Orlando's theory is wide in scope because it can be used by all nursing specialties and jobs. For example, in every specialty, we want to provide quality care and meet the patient's need, whether this is mother-baby, med-surg, surgery room, OR, whatever it is. For example, we also focus on the patient's needs in every nursing role. Nursing leaders, educators, and executives keep their jobs by teaching and enforcing quality nursing care, which involves meeting the patient's needs and having good outcomes. This theory can be used in many different ways within the real world. Although this is a nursing theory, the theory could be used in all aspects of life where products or actions are completed for another person. The deliberate theory is about being purposeful in your actions and fulfilling the patient's needs. This is the case with hospitals, restaurants, shopping, etc. Your goal is to always meet the customer needs. Just like when you go to a hotel or a restaurant, they always say that the customer is never wrong. In hospitals, many times our hospitals take the patient's sides almost to a fault, and we always have to meet their needs, improve, and do what they need. Nursing leaders also use this because their goal is to promote the hospital and to fill rooms. That's how they keep their job, and the hospital is able to gain money. Patients return to use our hospitals when they have had a good experience and they know that they're going to be taken care of properly. Nursing educators use this theory in their nursing work and teaching career. Nurses are always working to meet their patients' needs. This is one of the reasons that we have call bells to make it easier for patients to get us. They no longer have to come and walk to us. We even have gone out of our way to make call bells for patients like quadriplegics, where they just have to use their head to touch the call bell to make it go off. They use the deliberative theory in their teaching careers by teaching students how to meet all the patient's needs, including the patient's physical needs. Nursing executives are in charge of the entire hospital and usually sit on the boards and sit in board meetings. This is where they discuss productivity of the hospital and ways to improve the hospital, which usually include how well we have satisfied the patient. In all aspects of nursing, the deliberative theory is always used because we are deliberate in our actions and we take care of patients and their needs, no matter if it's physical, emotional, and we also not only take care of the patient's needs, but their family needs.